The next question is obstruction of venous. What is the question? Obstruction of venous drainage into which of following vessel is most likely responsible for this patient's scrotal enlargement? Yeah, scrotal enlargement, we will see the obstruction, okay, into the venous drainage. Okay, what is the question? First of all, in the question, a 55-year-old man comes to the physician because of the swelling and unusual heaviness of his scrotum that he first noticed a few weeks ago. When he is talking about the swelling and unusual heaviness of his scrotum, number one. Number two, the symptoms improve when he is laying in the bed, okay. He also reports a 5 kilogram weight loss and increased fatigue over the past 6 months. Weight loss, he has smoked 1 pack of the cigarette daily for the past 15 years, okay. Physical examination shows tenderness to palpate of his right flank. There are the soft strand palpable in the right hemiscrotum superior to the right testis. The strands increase with the Valsalva maneuver. Applying a bright light to the right hemiscrotum shows no transillumination. What is the question? He's saying basically a 55-year-old male present to you with swelling and unusual heaviness. The swelling decrease in size when the person lay down, okay. With this, the examiner is also not mentioning that the person is a smoker, yes, like this, and the mass will be increased in size when the person will stand like this or on the Valsalva maneuver. What do you think? What's the diagnosis? Yeah, very good. It's like a hernia. So we will say that you are saying that it's like a hernia, okay. But the problem is this. There is also a problem of the venous drainage. The examiner is asking about the venous drainage, and this is happening into which testis? Right testis. So if it's affecting the right testis, where the right testicular vein drain? Where the right testicular vein drain? The question is this: you forget about the hernia, you forget about anything else, but the main question which is examiner is asking that where the right testicular vein is drained, about the drainage. Okay, the right testicular vein, basically Pampiniform plexus, right testicular vein basically drain into the inferior vena cava, okay, and left testicular vein basically drain into the, we will say, the renal vein, okay. If someone have the renal cell carcinoma of the left side, then we will see that the blood is coming from the renal vein into the left testicular vein, and it can lead to the varicocele, left-sided varicocele. In which case, in renal cell carcinoma. But in this patient, he is not focusing on that the patient have the hernia or anything else. He is asking about the one thing which is for example, the testicular vein drain where? We will say the right testicular vein basically drain into the inferior vena cava. So what is the right answer? We will say the inferior vena cava is the right answer.